Thank you, thank you. Oh, okay. All right. So we'll get started, and I've started the recording already. And welcome everyone, and thank you, Lauren, for the introduction. Um, and I think before we go into the details of tonight, do need to let you know what we're sharing tonight is of a general nature. And apologies if I'm looking at all different ways. I'm working on two different screens. But yeah, so do go back to our MIPS website and refer to our handbook before you make an informed decision. Now, these are the learning objectives for tonight, which myself and Chai, our guest speaker, will be sharing, and more so on her experience. As you've seen in the invitation, she's a Charles Sturt Uni 2020 graduate, so she's been practicing in the real world for a few years now. So from my conversations with her, she's gained and learned a lot, and I'm sure she's very keen to share with her future colleagues as well. But the agenda essentially is for tonight, myself, I'll share, the first 10-15 minutes of a little bit on indemnity and a bit on the dental interview tips to look out for as well while you start preparing yourselves. Now, I know in the audience, mainly tonight is probably final years dental and oral health or dental therapy students, but I know we've got also younger cohorts, so all welcome. It's never too early to start preparing yourself for graduation. Now, as Lauren said about indemnity, you're probably at the stage of thinking, oh, what happens to my indemnity after graduation? And obviously, we all know that it is a part of APRA registration. And I think the big question I get a lot too, Lauren may have touched on this earlier on, is that, a lot of us ask, what happens, can I be with more than one indemnity provider? And that is definitely more than okay to do so. And at this stage of your career, we do encourage you to do so. Because while you receive indemnity for free, and we encourage you to call all the indemnity providers to ask any inquiries that you may have to get a feel of the services that each different indemnity provide. And when you do when you do receive that first invoice of indemnity, then it sort of does help you to make a quick decision in terms of who you would actually want to stay on with. And we've probably again touched on this already, that as a new graduate, you'll still be able to receive fee waive membership to about 18 months. So again, that good time to try different indemnity providers so you get a bit of feel of who you'd like to stay on with. And for those in the audience who are not yet graduating, don't worry, I would have your contact already throughout the registration process for this webinar. And I'll provide you, if I haven't already, of relevant information that actually suits your current career stage. And so what makes us different is that we provide these four pillars of support. So we've got a team of medical legal experts. So we talk about, encourage you to call us whenever little things that you feel something is just not right. Call us. Your name, you're not penalized from all the advice that we give you, and you don't get a black mark against your name. And so when you do call through, the course gets triaged. So we will ask you certain questions to be able to triage the call, whether it's clinically related matters or non-clinically related matters. We'll put you through to the right person. And we, as Lauren said, we're experts in this. So we do this, day in, day out, 24/7 a day. And so you'll be talking to our doctors, lawyers, or dental advisors who can provide that support. And again, that's what we are here for. So, you know, when you do come and go out in the real world, when you start, if you do finish work late one night, it's okay. You know, you can always call us after work. And we're also very big on education. If you're already a MIPS member, you might already know that we've got on demand, which you have access to if you're a member. And on there, there's all these recorded educations that you can go on there to review at your own leisure. And some of them also do give you CPD points as well. So do encourage to check those out when you're free as well. And obviously, health and well-being, you know, it's something that, you know, we look at it and treat quite seriously as well, because, you know, as a practitioner, if you're not healthy, then you're likely to make, you know, severe mistakes. So that's the point about indemnity that we would like to share with you. And then over to the interview points that we are sharing tonight. So obviously, you know, congratulations on receiving any interviews to come. And it is a really good time to, you know, get for your future boss to know yourself and for them to know you as well. And for both parties to get a vibe of, you know, whether the job environment and the culture of the clinic is suitable for you and what you're after as well, and vice versa, of course. So very good opportunity during interview times to go into details of your CV, expand on your skills and experiences to date, and, you know, basically sell yourself and tell them, you know, what an asset you can become, you know, by joining the clinic, and what attracts you to wanting to work for that particular clinic, and of course make a good impression. So here are some tips sort of to tick off before preparing for the interview. Obviously, I would suggest to look at the websites of the clinic to get an understanding of, you know, how they work, you know, specific examples that you can share up on the interview as well, of personal experience will be good as well to demonstrate you've got that experience. And obviously, best to practice makes perfect. So do get your family, friends to help you run through those interview questions. And obviously, most importantly, to get a good night's sleep as well, so you can best tackle those questions to come. Now, here are also some more tips to remember. You know, I would always suggest listen carefully to the questions, because and then when you answer them, you know, do address them directly. You know, try to be concise in your answer. But, you know, we're all humans at the end of the day. If you're ever unsure, just ask politely and ask for clarifications of the question that's been asked. Now, the tricky questions that you might get sometimes is that, you know, why do you want to work here? So some ideas to go to tackle that question could be, you know, it could be the culture or the good public image that that you've noticed within this clinic. You know, the reviews that you have heard from others about this particular clinic, and, you know, it could be the location that's perfect for you, and the size of the clinic might be what you're after. Now, I would use some wordings, you know, that you may have seen up on the clinic website to reflect on your answers. For example, you know, you've noticed that they've been, you know, long-serving community for the past 10 years, and, you know, the company's focus is on prevention, and which, you know, suits your working style and philosophy, for example. Now, your strength might be your organization skills, you know, your positivity, your bubbliness, and, you know, how you're a people person, that you know, you're always good at holding good conversations with patients. your clinical skills and your amazing memory, and remembering the conversations that you have with these patients throughout the visits as well, which is very important. And we encourage you use your real life examples to help in answering these questions. So whether that be from work or university examples or situations that you have dealt with in the clinics.
I think
Yeah.
one of the things to
Hmm.
note there, Jamie, and just trying to help you
Yes,
answer these things a
go
little
for
bit,
it.
and I know that we're going to have an influx of people arriving at 8, so I'm hoping Chai won't need to
Yeah.
start until 8. So with those tricky questions, I think it's worth
Go
noting that
back.
they're not there to trick you necessarily. So they feel tricky, but they might not actually be tricks. And I think if you can maintain a level head and think to yourself, well, what is it that the interviewer is trying to get out of me here? What are they trying to find out? Because normally, so those, what are your weaknesses? That feels like a tricky question. They're trying to trap you into saying something bad about yourself, but actually, maybe they just want to hear, how are you going to jive with the rest of the team? Is there a real hatred of chocolate cupcakes when everyone else loves chocolate cupcakes in the team? I know that's a very twee example, but that's the sort of thing they might be looking for. Or similarly, they might just be looking to see whether you can confidently and without sort of a humble brag, like you can actually reflect and make some kind of insightful judgment on things you genuinely are working on and trying to improve upon yourself. So it might be something outside of work. It might be, hey, look, one of my weaknesses is that I actually hate going to the gym. And I know it's really important to stay fit and healthy, but I'm not too good at keeping to that routine. And it's one of those things that I tend to let drop away. So have a little think maybe before you go into the interview, and um, remember that the interviewer isn't trying to catch you out, and they're not trying to send you off. They would like to offer you the job if you're the right person. So don't let that bring you down to your knees. Be confident and have a few thoughts in mind, and I'm sure you'll do a great job. Sorry, Jamie, go for it.
No, thank you so much, Lauren, for adding to that. Those are really valuable informations. Um, so I guess this bit here, if you've all got your phone there, which we probably all do, is I encourage you to take a quick shot of this. Is these are the eight common questions that are asked upon dental interviews. So I will encourage you to start preparing and form some answers of your own and try to refine it, and practice makes better. So as you go on, then you encourage yourselves that you can practice on other dental cohorts to better prepare these answers. Um, Now we're on to the final tip of this. I think Chai wasn't getting on till 8 o'clock, but I can't see Lauren as Chai on there now. Can you see?
Yeah, I saw her just before. I'm
Yeah,
presuming she hasn't gone anywhere.
yeah.
Yeah, she's there.
Okay, fantastic. So I'm on my final few slides. So obviously these are the final tips. You know, to be prepared for the interview, and always be concise and give relevant answers. We encourage, definitely don't talk about any personal issues, and just stay positive, and give that big smile, and obviously sell yourself, and give it all it takes. And like I said, practice makes perfect. But otherwise, I think that's all the time I have really. And good
That's some
luck
great
in
tips.
preparation. Hey,
That was some great tips. Thanks, Jamie.
yeah, no
I would add
worries.
fake it till you make it. Like you said, a
That's
big
right.
smile and a bit of confidence goes a long way. And
Yeah.
I know that when I've interviewed people in the past, as long as it's somebody that I think I would like to work with, even on bad days, then most things are teachable. And people do obviously learn a lot on the job. So if you feel like you've got some shortcomings, don't panic about those. If you're a kind and smiley and friendly person, that goes a heck of a long way to being employable. So, um, If in doubt, give it a good old smile. That's what I reckon.
For sure, a smile goes a long way. So I'm up to my final slide. So good luck, everybody. While you prepare for these interviews. And yeah, well, here comes to the part that we've all been waiting
I'd just
for.
like to start the evening off by saying thank you for taking the time to join, so that I do have the opportunity tonight to share a little bit about my journey. So first of all, congratulations. This is the final hurdle. Before I get started, I just want to acknowledge the traditional owners and custodians of the land on which we all meet today, paying respect to our elders, past, present, and emerging. And with this acknowledgement made, may we open this humble space for mutual learning, co-creation, and story time. I learn a lot from stories and analogies, so I've weaved them right throughout my presentation just to change it up a little bit. And I'm guessing when I was preparing, this is what I was thinking to myself: what can I contribute that you can't find of Google, which is everything's on Google. So I thought experience and something heartfelt. So hopefully you can take something home with you. Congratulations on all your achievements nonetheless. There are many things that you're probably juggling right now, such as your finals, your assessments, your patient requirements, and all that. But for this presentation, I think I would just like you to be present and give yourself a pat on the back for even coming this far. Been there, done yet. I've been a year and a half out, so it still feels pretty fresh in my mind what final year felt like. So pushing forward, you've completed your final hurdle, or you're about to. You've started your job hunting procedure, and you're probably, some of you, excited to moving home. So this is also the time to start to celebrate, but also to hone in on what you've experienced. This next slide is the mind of a dental student. Pretty much you're thinking periodontics, restorative dentistry, pros, oral surge, endo, and all the rest of it. So I guess I put this up is because that's probably your brain on a daily. But for tonight, I'm just going to get you to relax, put your laptops and your notepads away, and just enjoy the stories and the takeaways of the moral of the stories. I do want to point out that MIPS invited me to join, and I don't know if Jamie had a chance to mention, but I had this opportunity in the off chance that we've been mates for 20 years. I am now a MIPS member as well, and that was purely because I've learned about the 24-hour support. And I think that's pretty big being a first year or second year out, because there's so many things that you run into. Sometimes you just want a bit of reassurance. And so today I messaged Jamie and I asked her to find the answer for me. But pretty much there's these hearsays in the community to say that sometimes when you ring up your insurance company to go, today I had a bit of a yucky situation, this is what happened, and they start making marks against your name. I asked Jamie to follow that up for me, and she returned back. I'll just read it out. Advice and support are some of the key benefits of MIPS membership, and we actively encourage you to make use of these benefits. To that end, you are not penalized for calling us to discuss a sticky situation, nor are your membership fees affected. So that's massive. Okay, continuing on, even if the situation does escalate to a complaint and we engage lawyers or commit to other types of assistance, there is never an excess to pay, and the cost of your membership will not be impacted in the future. Membership fees are calculated based on the risk of your scope of practice, your location, your past practice, and private workload. It's extremely rare for your past complaints to be factored into the cost of memberships. I think if you are with MIPS, and I believe the first year out is free, that's seriously a point to consider and utilize their services in doing so. So on the point of this, I've had a few friends and few stories. I've recently heard of a boy who is a first year out. What he did with an extraction was he must not have leveraged right. He must not have had a good purchase point, but he took the whole buckle plate out with it. So that was a 4-6. So the 4-7 is still in the mouth, meaning that the 4-7 will probably have a lot of root resorption and bony points of exposure. So those are the things that you probably should contact your insurance about, because that is probably a clinical error. Going on. So a little bit about me. So I graduated in 2014, as an OHT from Otago. I then worked at the CCLHD as a dual scope practitioner in 2015. Now, what happened there was at the time, I wasn't actually anticipating becoming a dentist because at the time I thought dentists had a persona and I didn't want to become one of those. But whilst working at CCLHD, I saw a lot of disparities. I saw how big the waiting list was. And it just didn't feel right that as an OHT, all I could was either scale and clean or do fillings for under 18s because I was limited by my scope where I trained in New Zealand. Anyhow, I wasn't having the best of time, and I spoke to my boss and my colleagues, and that's where I met Grace Munns. So I don't know if you guys know Grace Munns, but she was a colleague of mine, and she was studying at CSU. So I think the point that I want to make here is if you're not feeling quite right, sometimes speaking to a colleague that's like-minded can inspire you. So she inspired me. She got me to apply for dentistry because she said, if you want to make a change, you will have more independence and scope as a dentist. So there I committed to another 5 years. I graduated in 2020 and I started at Bell Dental in 2021. I was the winner of the John Kinross Prize for Proficiency in Dental Ethics and Professional Responsibility. At the time, I had no clue there was such an award, but it felt pretty good to earn it. So that's pretty much saying that all your teachers, your lecturers, they all deem you to be a student or a clinician that values dental ethics and hold yourself to a certain degree of integrity. So sometimes in the bustle of dentistry, it is easy to lose yourself in wanting to get the fillings done, push forward something that might not need. So just be wary of that. Your tutors are on the lookout for those. They might not pin you for it, but in their mind, they know what kind of character you're displaying. Thereafter, I graduated. I started working at Bell Dental, and my boss has been absolutely supportive in me commencing my honours degree, 2021. And dare I say, this boss of mine, he's pretty supportive in like continual growth. And so I think all up this year, I might be taking about 2 months leave, and he's been generous and encouraging. So that's the difference in trying to find a boss, not just for the work but also as the character that he is, because you will run into those situations where you will have to negotiate your work hours. So I'm currently based at Newcastle, and I believe we might be looking into expanding our team. So there you go, be on the lookout. This is a bit about how I landed my first job. Please do be aware that these are my experiences and no experiences only, and there's neither right nor wrong, but I think everyone sort of has their own experience in the job hunting area. Mine was unconventional. So your typical process would be, submit your resume, wait for someone to get back, anxiously wait to see if you got an interview, anxiously wait to receive an offer, or if you don't receive an offer, and then sign the contract, and then allow your life to begin. So have you noticed that I sort of repeated the word of anxiously? I guess that's probably the process that many of my peers experienced, because there is this expectation that I must find a job. I think in making that comment, I'd like to give the advice to say everyone will eventually end up with a job, but if you are patient and you know what you are and you know what you have to offer, you'll be more accepting of whether you receive the job that you get or you don't get, and knowing that you have presented yourself in a way that's authentic to yourself. So for me, my experience was quite different. I didn't submit a resume. I didn't have an interview. The line that I got was just give me a buzz at night and then we can chat through it. So then I received my offer after a sort of 1 hour phone call. I went and met my boss. He offered me the job and then I signed the contract. So like all good stories go, this opportunity actually came about after an episode of failing to numb up a 6-year-old patient. So what I did was I delivered my LA. Her lips were numb, so was her tongue, and so was her chin. But when I started drilling, she would jump. And at first I thought, oh, she might just be anxious. So I reassured her. I did all my tests, and then I realized, oh, I don't think she's actually numb. So at that point, I didn't really think to do a long buckle or other innovations. I sort of just went and got my tutor. At this point, my tutor was like, Chai, are you ready to graduate? Like, that's next month. And then that sort of got me all antsy, going, am I ready to graduate? Like, I can't even numb up this kid. So I sort of messaged my friend, who at that time I met through a rural health conference just for 2 nights. But I guess be cautious, the personality or the person that you are day in, day out, because you have no idea when certain people are gauging you and coming up with a conclusion of the person that you are. So this particular friend decided that I was pretty down to earth. And so she mentioned when we were staying together that if I ever needed someone to observe, she knew a good dentist, which is my boss now. And so at that point, I hit her up, and then she told me that he's actually looking for someone to join the team. So that's how I found my job. And then in the off conversation that I had with my boss, I asked him, like, till this day, you realize you still haven't seen my resume and you never really gave me a proper interview. We just sort of chatted. Why was that? And he said, well, it's because the mutual friend of ours said, Chai's pretty down to earth. You'd like her. And so I guess the moral of this story is character referrals outweighs paper applications by a mile. Like, that job didn't even hit the internet. So I was pretty lucky. I was the one and only person. And I've always believed that the universe gives you what you emit outwardly. And so long as, I've given myself everything that I've got in the present moment, given it good lash, then I leave everything up to the greater beyond. So that's one story for tonight. The next story is a parable, The Boy, the Rock, and Its Environment. And you might be asking, like, I'm here to hear interviews. I'm here to hear your experience. Why are you trying to tell me a story? I think I look back and I sort of thought, like, how did I get this lucky? Like, I can't rave on enough about the job that I have. My boss is committed to proper dentistry. He's a man of, I would say, courage and integrity. If one of his RCTs failed, he's happy to send the patient off, give them a free consult with the endodontist, and he'll just wear that. And I've seen him do a free bone graft for things that didn't go quite right for the patient, although it wasn't my boss's fault. So I think someone who can see beyond dentistry being all about the money or the losses he's making, I can see that he's a genuine man trying to uphold good dentistry and serve his patients in a cost effective and durable way. So I go, well, how did I get this lucky to get a mentor that practiced good dentistry? And so I always think back, it's because I had a good idea what I was looking for. And I wasn't looking just for a job or just a starting point. I had a fair idea what I was willing to compromise and what I wasn't. So hopefully the parable will stick with you when it comes to your interviews, as well as you trying to come up with your answers for your interview questions. So how the story goes is one day a young boy asked his father, what is the value of my life? And instead of answering, the father told his son, take this rock and go sell it at the market. If anybody asks the price, raise 2 fingers and don't say anything, instructed the father. This boy then went to the market, and then a woman asked, how much is this rock? The boy, obediently as he is, put up 2 fingers, and the lady goes, $2, I'll take it. The boy went home and told his father, a woman wants to buy my rock for $2 to put this rock in her garden. Sorry, here comes the images. Okay, the next day the father said, son, I want you to take this rock to a museum. And if anybody wants to buy it, don't say a word, just put up your 2 fingers again. The boy then went to the museum and a man showed up wanting to buy the rock. The boy didn't say a word but put up 2 fingers, and the man said, $200? I'll take it. The boy was shocked, went running, and told his father, a man wants to buy this rock for $200. I think I upped it, 2,000. Anyways, his father then said, son, the last place I want you to take this rock, the same rock that he had the first time, is to a precious stone store. Show it to the owner and don't say a word. And if he asks for the price, just raise up your 2 fingers. The son then ran to a precious stone store. He showed the rock to the owner. Where did you find this stone? It is one of the rarest stone in the world. I must have it. How much would you sell it for? The boy put up his 2 fingers and the man said, I'll take it. I'll take it for 200K. The boy, not knowing what to say, ran home to his father and told him that there's this man wanting to buy this rock, the same rock, for 200K. His father then asked his son, do you know the value of your life now? And I think this one depicts it very well. It matters where you do decide to place yourself and don't ever compromise the worth of yourself in an environment that won't appreciate what you have to offer. So no matter, where you come from, what your experience has been in dental school, um, the color of your skin, or how much money you have in your family, or your grades in dental school, or the experiences you've had, it it doesn't really matter at this point because everyone is going to graduate with a degree. You're all going to get registered, get insured, get your provider number, and everyone stays on that same playing field. So if you live your whole life like, like the $2 rock or the $200 rock or the 200K rock, it's actually where you place yourself. So I hope when it comes to a job offer and you feel iffy in your heart about where you're about to work, probably take that time and think through that story and choose whether or not you want to put yourself there. This comes to another experience I had with a job interview. So I had this practice in Bathurst. So what happened was he arranged for an interview for 9 o'clock at night. So most people they'll go like, "What the heck? Who does an interview outside of work hours?" Well, this gentleman was offering that, and I sort of thought, I've got nothing to lose. I'll take it. So anyhow, it got pushed back to 10:30 because this man had to put his child into bed. And I go, all right, he sounds like a family-centered man. Not bad. Okay, I'll take the 10:30 appointment slot. Anyhow, I had the interview, and I don't know, my gut just felt like he was saying all the right things, but I wasn't convinced by what he was articulating. So I went to work, or I went to my placement the next day, and at that time I was at Bathurst Hospital. I asked Dr. Banu if you guys know her, but I said, oh, I had this interview last night with this dentist. And then my friends on the side going, and he wanted an interview at 10:30 at night. Who does that? And at this point, my tutor sort of jumped in and said, oh, Chai, I don't think you'll like it there. Like, based on what you talk about and what you're looking for, he hasn't got it. And I sort of go, what do you mean? And so she sort of alluded that there's a few public patients that's gone there with a voucher and they haven't come back with really good treatment or good results that she thought was probably edging on the side of unethical. So remember what you are, and people are able to see what you're looking for. They'll be able to guide you. If you if you have a job offer or if you're going for an interview, most of your tutors, most of the people that you are being taught by will probably have a fair idea of the words that's going around. So make sure you check with them. So moral of the story, what kind of rock will you be? That's determined by you. And thereafter, it matters where you decide to place yourself, and asking you to choose the people you surround yourself with wisely, because that can make all the difference if they see value in you. Because I think it's human nature to want to be appreciated and wanted. So if your future dentist is only seeing you as a money making machine, well, my question to you is, do you really want to work there, even if you can gain a bit of experience? I would say look more, open your what's it called, your diameter and where you're searching from, your perimeter, and you'll definitely find a job with a good dentist. So don't just take up the most uh, convenient one in the location you want to work at. Um, Next page. I think I've covered this slide a little bit, but how I landed my job, I still think that I did have the courage to be myself, even though I'm quite unconventional. I think in my head, I had a fair idea that I wanted to sleep soundly at night. I didn't want to take work home with me. I didn't want to worry about, did I do that right? Did I do that right? Could I, should I? I needed someone that is there to mentor me, someone who's committed to the care of our patients, and therefore they will mentor me in that way. I decided I shall not fake it till I make it. My patients trust me, and I will uphold myself in getting the clinical guidance to get them a durable result. We've had a fair few patients come through who told me, this restoration, um, a, a franchise company has attempted it 4 times. They've charged them all 4 times and still not gotten them their results. To me, I think it's a bit absurd that if you can't get a result for your patient and that same feeling's falling out, it's not the patient's fault. You got to sort of think, have I accounted for the occlusion? Have I done something wrong with my bonding? Is there other factors that I haven't accounted for rather than doing this um, times? Anyhow, that's something to think about because I think we all have had limited clinical exposure during uni, and probably with COVID and all the rest of it, you probably haven't got the full exposure that three graduates 3 years ago would have had. So I think that's definitely something that should be considered, I think, is the mentorship as well as the company policy and redoing some of the work if it's a failure of our own. I think honesty is massive when it comes to work that hasn't worked out, particularly if you know out front that it is your fault. Um, Second point, do you know what your practice philosophy is? And I think you try and align whether or not your philosophy aligns with your practice philosophy. Um, and this is my own attitude of gratitude and learning, openly to perspectives different to my own. And if anything, I think my boss picked up on this personality flair of mine, of how sort of optimistic and open minded I am and how willing I am to try things, is sort of what he hired me on. And he was, yep, this is the one. Um, I was sure that I didn't want a business driven model or a practice where I have to sell treatments, where I have a quota to meet. But unfortunately, from what I'm hearing from my colleagues, I think some practices are starting to run KPIs. So just be mindful if you're signing yourself up to a practice that might give you a bit of pressure doing that. These are the questions that I got sent. So, what is the number one thing employers are looking for in a new graduate? I did a Google search because I was sort of thinking I didn't quite go through the same process that you guys will be doing. Um, Teamwork, communication skills, self motivation, time management, independence, creativity all sounds pretty generic, I'd say. And it all feels like things you throw into a sentence. It sounds like you're saying the right things, but it's kind of like, well, how do you show it? So, my number one thing is what is the number one thing you are looking for in your first employer, and whether or not you have that. That's a different way to see that question. Um, Sorry, what's this one? Oh, yeah. When I asked my boss about this question, he was saying that he's looking for confidence, the right attitude, and whether or not that there's room for growth as a clinician, if you could be taught and be guided. Um, that's about it for that slide. Sorry. This next slide, what is the number one things employers are looking for in a new graduate? So bearing in mind, any job you'll be competing with every other dental student that is graduating. And so I would say is what makes you a company asset rather than just another employee. It's actually your attitude. My words didn't show up. So I think your attitude is something you can't fake, like how you conduct yourself, the words you choose to use, how you react to certain situations. Those are your attitude that is being underpinned. So I think deeper to that attitude is your purpose. So do you know your why? That's something you have to think about. Um, my why for working at the practice I told my boss that um, after seeing what I saw at Central Coast local CCLHD, I've decided that I'm committed to making dentistry more accessible, more cost effective, and being able to deliver results rather than Fujiing everything that I see and hoping that it lasts. And so he said the protocol that he's teaching me, he's committed to 30 years, and his fillings and his composite resins have the predicted result that can last 5-10 years easy. And, that sounded like what I was looking for. What he was doing was instead of doing a lot of ceramics, he actually has, I would say, cracked the code in being able to put 5 surface restorations in the mouth and shape it like a full crown, where it has durable results for more than 10 years. I've recently seen in his recall patients. So, yeah, I'm committed to the results and delivering that for my patient, and he had to offer that. And I had that learning attitude, so he passed on very generously this protocol that he's held by himself for the last 30 years. For me, I see that, people say you become a combined person of the 5 people you spend the most time around. So your workplace and your colleagues. So the way I see it is they're the families I choose for myself. And once you're committed to once I've committed to working at my practice, I invested my time, my effort, and deep care for my colleagues. I think you'd be joking if you say that, you all get along at all times. Dentistry is a very stressful place to be at some days, and not everyone has good days, and somehow they all line up together. So you have to come back to, what's your reason for being there? And if you want to be there, then what will you do when faced with an obstacle like that? Um, So I would say if you appreciate being at work, they will appreciate you being there. And so in saying so, you become an asset. So back to the story was the rock. So on the left, that's just an unrefined Punamu rock. That's a greenstone of New Zealand. And if there's any Kiwi accent in my speech left, I grew up in New Zealand. Anyhow, it takes a process of re- refinement, a lot of tempering, and a lot of carving. So, what I'm trying to say is your work is here to help you evolve, and you'll definitely run into things. And as a graduate, I would say I probably had the biggest growth spurt in the first 6 months of dentistry. Um, and I learned so much compared to what was taught sort of over the last 5 years in my undergrad course. And I was exposed to so much. And 1 year in, I think I was pretty comfortable doing root canals, using the rotary. What else? Diagnosing, diving into deep fillings, and being able to manage my patients in a way that they don't feel like I'm incompetent. In the start, it was really good that I had my boss vouching for me. So he said, "Look, I've taught Chai the protocol. She's following exactly as I do. I'll come in at each stage. So you're in good care. She's very meticulous. She's very careful, and she'll always scream out if she needs a hand." So I think having your principal dentist vouch for you like that really gives your patient the confidence that he's supervising you. But my boss would also say, "Look, I need to pass on this protocol because if I get taken by the 5-time boss tomorrow, I need someone to carry on this protocol to offer this sort of dentistry because no one else offers it at the moment." So I'm pretty lucky in that sense. In learning the protocol, it was hugely stressful because it's all hands on. It's all about your fundamentals, how to do your high speed, how to do debride deep caries, how to determine that it's caries free. We all know it in theory. We can do it on an examination, but can you actually do it clinically? That's the other question. Because if you're not doing it properly and there's still areas around the DEJ that will compromise your bonding. So that's something to factor in is what I think I'm doing, what I'm actually doing. So it's really helpful to have someone who's willing to come in at every single filling to help you check that it is caries free for good bonding to happen. So my boss did actually do that for me for probably 3 months. So sounds embarrassing, but I think you gotta own where you are. And at that time, I thought I was caries freeing. I thought that I was just taking out the leathery, leaving affected denting. My boss would come in and he'd be like, "This is all soft." And I was like, "Well, it wasn't." And he was like, "Well, can you show me what kind of motion you were doing?" And he'd go, "Well, that's the problem." And so he'd show me how to use my spoon excavator properly. And you think, like by graduation, you'll know how to do it. But I'd say I was the first year of COVID, so 5th year was pretty much non-existent. I think I might have done 6 to 8 weeks of clinical practice, and the others was waiting around for a patient to come through. This one here, fundamental.
Just a quick
Yes,
question come through from the audience from
absolutely.
Gabrielle. She wants to know that if she's considering employment away from her local area and can't really ask around about the employment opportunity or what the principal dentist is like, would it
Yep.
be appropriate for her to ask to speak with other employees in the clinic, like other employed dentists, to get a feel for the workplace attitude and mentorship vibe and that sort of thing? Or what would you recommend?
I would say do it with caution. If there's if if there's someone, if you don't know anyone, there's a Facebook group called DPL Online. I think if you pop that up on there, most dentists will be able to tell you some of the experiences. So, to Gabrielle, have you heard of the DPL group on Facebook? Just now. Well, have a
Yeah, just
search, ask to join in. I think you might need a recommendation to enter the group, but pretty much it's a massive group of dentists all up on there, and everyone from graduates through to really, really experienced senior clinicians are all on that Facebook page. It's a very encouraging place. It allows you to put your questions up on there. Um, I think if you're looking for some non-biased insights, maybe that's a good place to try. The reason I say with caution is because you don't know how then the person you reach out to relays that onto your boss or your potential employer. That's just something to bear in mind. But if you are going to organize the interview, have the interview, ask if you can visit. When you're there, you can then ask those questions. It'll be quite natural that way. How do you enjoy work? What's this workplace like? Something like that. You'll be able to get a good gauge of the running of the practice. Does that answer your question?
I think the other thing to bear in mind is some ex-employees and that sort of thing might have biased opinions. It's really hard to tell, right,
That's a good
Chai? It'd be
point.
hard to navigate what's the truth and what's not.
Yep,
We've probably all been in relationships where the ex has spoken badly about us and that sort of thing. So we know what happens when relationships end, and work relationships are no different. So it is really hard to navigate, and you've got to trust your gut a little bit, I guess.
absolutely. No, I agree with that. So trusting your gut um, is probably the way to go. Thanks for that. Um, I'll continue on with the fundamental beliefs. I think these were mine. I'm just throwing it out there so you guys can get an idea of, okay, that might be me, that might not be me. If that's not me, what is my core beliefs? Because if you're very clear in what your core beliefs are, those would be what I call your non negotiables. So if there are your non negotiables, you should wear it with pride, wear it with confidence to be like, this is the reason that I exist, is for me, all happenings happen the way that it should be. So I'm not one to complain for things that pop up, plans that change, having to miss a lunchtime. I'm just sort of go, okay, this patient has a toothache. My only free slot is my lunchtime. Take a protein shake, rock and roll. So I think having that underlying core belief allows me to deal with these situations with a certain kind of attitude that adds value to my practice. Um, I believe that your vibes attract your tribe. And I think in this case, my boss has a philosophy that is very much similar to myself. And so we synergize over that. But in order to attract your vibe, you have to have an idea what your vibe is, and you have to choose to remain consistent to it. I know there's a lot of pressure now to develop a persona of what dentists should be. The way I see it is if you develop a persona, you end up living two lives. I think there's two ways in being professional, but being yourself versus thinking what your patient wants to see as being professional and trying to paint this persona on. Because a friend of mine has tried doing that, and before they know it, they're telling me that they feel like they're living two lives and they're not coping. The third point, you manifest your belief. Your world is simply how you choose to see it. I think Lauren, was it? The lady that just added before.
Yeah,
Lauren. Lauren was saying, like, people do have their biases, and the biases arises from the perspective that you take. So just be wary that whatever you see the world, just if you can understand this concept, it's simply a reflection of your beliefs. So if you reckon your world, like, your patient hates you, they don't want to be seen by you, um, if you feel victimized, that's probably your vibes and your belief that you are the victim. But if you see that as that's your patient giving you feedback, that's the patient wishing to be seen by a senior clinician so that their money goes to good use, you won't be offended by it. You go, look, fair enough. I would probably say that I would be the same in your case. I'll refer you back to my principal dentist. And you just roll on with it. And how you sort of engage in all these things that you don't anticipate actually is the reason why your boss keeps you on and sees you as an asset that he then continues to reinvest in, because he sees, look, this person has the right attitude. So my conclusion is, do you know you? Because if you don't know you, how do you expect other people to see value in you? What is your wife pursuing dentistry? That's always important. I think within the first 6 months, I was pretty burnt out already. Like, we're transitioning from 3-hour clinics, or at most 2 back-on-back clinics where you DA for one, your clinician for one, you DA for one, your clinician for one, to having full day patients, 40 hours a week, every single patient, probably questioning if you have the right ability to do what you say you will and be the charge that you're charging. How do you go about having the senior dentist supervise your work without the patient lose? I think finding the right boss. I was pretty honest upfront with my boss, going, look, COVID days, we barely had any exposure. Any exposure I had, I told him. The areas I didn't have, I told him. So I think if you are honest and authentic about your experiences and your ability, you don't try to fake dentistry, because you can't. If you can't drill confidently, if you don't know where the pulp is, find a boss that is understanding rather than penalizing. And if you feel like they're penalizing you, well, I don't think that's the right practice you should go into if these are the skill sets that you have limited scope over. So I was pretty upfront. I told my boss my pros exposure, I had a full upper denture simulation because I had no patients that needed full upper denture. My partial dentures was a 1 tooth replacement. I mean, you get the cases you get, like, they can't penalize you for that. But if you're embarrassed about that, that's when your problem comes in. That's when you start upselling yourself to the point where they have a false idea of what you are. When they have a certain demand based on what you told them, there's a deficit. That's when things sort of unravels. Um, so I would say at my interview, I was upfront about what my abilities are at. I said, look, I'm a cautious dentist. I feel like if I can avoid a pulpal exposure because I'm not quite sure where I'm going or how high things are you able to give me a hand? He said, absolutely, come grab me. And sometimes I feel like an absolute idiot. Like, I'm not one of those talented dental students. I was always a hardworking dental student. And that's why I always say attitude, attitude, attitude. The attitude to learn, the attitude to admit that you don't know, but you've tried to know, you know it in theory, but you don't have the clinical exposure. Acceptance of the way that you are, but willing to learn and put in the hard yards goes a long way. So I would say my boss was giving me a hand with, like, caries debridement, particularly really deep ones, or what I thought was deep, he comes in, it was like still a mil and a half off being deep. So I feel it's really silly, but if you're too scared to ask silly questions, well, what kind of clinicians will you be? You'll just be so-called a blindly courageous one, where you just keep going until you go, oh crap, like, that's the nerve. That red wasn't, decay. So I think if you're unsure, make sure you reach out for help. If you get fired on that, at least you can rest soundly at night and go, at least I was ethical, right? If they can't appreciate you for expressing the need for assistance, being a new grad, then I think you need to decide whether or not you're working at the right place. And I can tell you, like, the business model of dentistry, unfortunately, is the way things are headed. But being first year out, I think this is the deciding year of what kind of clinician you will become. So just be cautious with where you take up your first job. Does that answer your question, guest? So I've got a quick story here. Oh, time goes pretty quick with stories, doesn't it? Does anyone know that chemical compound? I didn't know until I searched it up, but that's a bisphosphonate compound. Anyhow, I had this patient come in. She was booked in for a restoration, and I said, sweet, checked her medical history, goes, okay, bisphosphonate, we're good because we're just doing restoration. This was very early on in my work, probably first 3 months in. And then I started debriding and then debriding and debriding, and I go, oh, what's that line? Turns out there was a horizontal fracture running from like a medial distal fracture right through. And I popped it in the crack, and then I gave it a bit of a pressure, and the patient could really feel it. So then I was like, well, you know, this is not a prognosis. This is not good prognosis for a restoration. In my boss's word, that tooth is caca. So anyhow, I jumped into my boss's room. I go, this is the clinical finding. Poor prognosis, exo. At this time, I was so stressed with how deep the debridement was, I completely forgot that this patient was on bisphosphonate. So my boss goes, okay, exo. I didn't tell him she was on bisphosphonate, so I started exoing this tooth. I also told my boss I'm not very experienced with my exo. The ones that I had was at the LHD, and they were mostly perio involved ones. This one here was a fully full solid tooth. It was just yeah, not a easy exo in my experience. Anyhow, I snapped the crown off. I tried to luxate, used some cryos, couldn't get any motion. And then so I called my boss in. He removed it. He told me to move on to my next patient. So I did. And then he asked me to come side and goes, do you realize the patient was on bisphosphonates? And I said, oh yeah, I do. And then everything sunk in. I was like, oh crap, like osteonecrosis. Wow. So my boss said he would take over from here on in. I think I took a screenshot before. I was going to add it, and I wanted to sort of display what a supportive boss sounds like. I think we all say we want mentorship, but what does that actually look like? My boss said, you know, he texted me that evening, you're doing well. What did he say? Oh, yeah. He goes, Chai, I hope you're okay. I'm checking in on you after today. Sometimes dentistry can be hard and we're all humans. I've had my fair share of sleepless nights. If you need to talk, call me or drop me a line. Understand also that most people are more resilient than you think. So this is an, I guess, reference that not every patient get osteonecrosis. So then I replied saying, like, I'm just a bit upset with myself. How could I miss such a thing? It's not like I didn't see it. I saw it. It just slipped my mind. I didn't even think to tell him. La, 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 la. My brain was going a million miles an hour at this point. So he then replies, you're doing well. We'll share the load on this one. Remember to focus always on the basics. The basics will always carry you through to the deeper circles. Glad you're okay. See you tomorrow, a brand new day. So I think that really demonstrates, like, when your principal dentists say they're there to support you, I think only events that creep up will tell you if they honor what they say. And I have been really lucky that he honors it. We actually had a bit of a scare with this patient. She called up. We reviewed her. We contacted our oral surgeon. My boss prescribed antibiotics on the day. And then she called up. She goes, I think I can see something that resembles bone. So at this point, I was really stressing out, but it turned out it was just a bit of bone being pushed to the surface. Anyhow, it helps a lot if you have something like an insurance company like MIPS. You could have called them, or I could have called them. And having a boss that will wear it with you. So this is, what is the number one thing you were looking for? These are some of the things that I was looking for, just worded down. I don't know if the slides will be made available, but if so, you can sort of think those are the things that I value. And trying to see if it aligns. This is another question. What are some red flags? So eagerness to sign you on without feeling like you're being heard, or they're wishing to get to know you. They're kind of like coming across as desperate to sign you on. Be cautious of that, because the question goes, well, why haven't other people taken up the job? Why are you desperate to get to sign me on without knowing what I'm capable of. Have a look to see what the books are like, or ask what the books look like. So empty books is, I guess, something that you should be aware of. If the books are empty and the employers are only wishing to pay you commission, that's something of a red flag. Short appointments, 15 minutes for consults, 30 minutes for cleans. Anyone that can do 30-minute standard cleans, I'm hugely surprised, because I still take 45 to an hour. I floss down every interproximal, make sure I've gotten all the deep subgingival calculus. I think if you're willing to compromise flossing, you have to ask yourself, what kind of clinician are you becoming? Have a look at infection control in the practice. Are the single-use items single-use, or are they skimping out and they're not doing anything? Another way to see if they're committed to infection control is whether or not they're accredited. That's something to look out for. What are the retention rates of their current team or dentists? That's something to think about or ask. Again, the message is your work is there to evolve you no matter where you work. It's what you make of the situation. As much as I'm sort of talking about ideals, and I feel like I found reasonably ideal place to work, not everyone will have the same opportunity. Do you think it's too early in the year to apply for jobs now? Yes and no, but each to their own. In terms of the job application, some of my friends locked in their jobs because that was where they wanted to go, was back home. But I think there was also people who locked in something, and then the dentist on the other side found someone better. So I think each to their own, meaning if you don't apply it and you can't find a job at the end, will you regret it? If you will, apply it. If they're offering you a job, um, if you take it, then you have to uphold integrity. I think that's how I see it. If you're shopping around trying to find the best deal, then uh, I'm not sure if Jamie or Lauren have better answers than that. My boss does implantology as well back in the day, so he was able to extract that tooth rather atraumatically. So if we go back to our notes, it's kind of like anyone with osteoporosis. Part of the equation is the medications, and if they can go on a drug holiday. If not, the atraumatic extraction. But if we're that inexperienced, I would say, even my boss says, anyone with osteoporosis on Prolia, he sends them straight to the oral surgeon. Uh, what what would you advise someone who takes position in new clinic books are open commission only? I would say it's up to you. It depends what you're looking for. You can try and negotiate it. So the way my boss has done for me is he said, look, I'm committed in you doing good dentistry, and that you don't feel like you're put under the pump to do dentistry to earn a wage. So he gives me a salary, and then commission. I think 35% commission. And so the equation goes, he pays me weekly, and then by the end of the month, we would calculate the total bill that I've been anxiously wait to see if you got an interview times 0.35 minus the money he's already paid me. And then he'll pay me the deficit. So technically, I'm still commissioned, but I'm also getting a wage, which means I would never be tempted to do anything to bring money in or to stay afloat financially, if that makes sense. So to Shaz, if you're asking about that, ask your boss if that could be a possibility. If they're still building their practice, depends on your financial situation. It's not a bad place to go if you're not financially pushed, is because in my book, when my book first opened, it was rather empty because most patients still only knew of my boss. Because of my OHT scope, I started doing like hygiene, signed the contract, and with my boss, I said, look, I'm a dentist, but I'm still very, I still feel very, I still feel not that confident with my dentistry scope. Are you able to let me just do my hygiene scope with the odd, surface, one surface, two surface restos, just to get used to the environment? And he said, yep, go for it. And I've noticed that it actually worked in my favor. My patients trusted me because of the cleans I was doing, how thorough I was, how committed I was in giving patients the power to be able to look after their teeth and their gums. I also actually told my boss, hey, look, um, I'm not a quick worker. Can I extend our new patient exams to an hour 20? He actually said yes. So I really enjoyed working in my first sort of month or two because I just had a really good yarn with my patients, get to know them for the person they are. These patients turned out to be my dental or dentistry patients in the end. And because you've had that rapport, they're very happy to let you do the dentistry and my boss to come in and check every step. So that's my answer. I think that's it. Thank you. How do you find out if a practice accredited? They would either display it or you can just ask your boss, hey, are you guys accredited? It's a lot of tedious paperwork to become accredited, but if someone's accredited, it shows that they've committed to a high degree of infection control. Okay, I'll move on to the next slide. I hope that answers your question, Katie. OHTs, I believe there's some OHTs. I hope what I've said is sort of relevant to what you guys are doing too. Being dual scoped, I think it's really exciting. And I believe like CSU grads, Newcastle grads, your age limit is a lot higher. When I graduated, my age limit was 18, which meant I wasn't really doing much restorations. I would say, although you're dual scoped, keep a humble attitude in the ways that dentists do things or the principal dentist. Communicate openly, honestly, and with respect, because I think being trained in dual scopes, dentist seems to bad advice to say everyone will evolve a different way. Although there's the still, although with the same clinical presentation, a dentist will approach it differently compared to an OHT. A dentist also has more scope in terms of, endodontics, periodontics, prosthodontics. So they can sort of, when they're treatment planning, they're probably thinking about a bigger picture with their understanding of pros. They might see a situation differently. And if you allow your opinions to clash, that's when frictions start to happen. That's talking out of experience. We took on a Newcastle grad earlier this year. I think she decided that the practice wasn't for her and left within the first 3 months. She was pretty eager to do her therapy scope and wasn't wanting to do her hygiene scope. And I felt like as a dentist, I was probably a lot keener than she was to look after my patients, do the recalls, and all she wanted to do was restorative. So just be wary how you come across, and be understanding that if your dentist wants to start you off with cleans and slowly ease you into therapy, it takes patience. That patience will pay off because it come across as you're a reliable, trustworthy person who's not eager just to do restoratives. Um, Eat a bit of humble pie. Ask your boss, how do you guys do it? Do you mind if I come in and observe? Just to learn how they do things. So this particular OHT, she was unwilling to isolate teeth the way that my boss demanded her that she does. So it was very obvious. He said, it's my way or no way, because the way she was isolating was not keeping moisture out. And we have a really strict resin protocol, resin denting bonding protocol. Be open in discussing and exchanging diagnosis and techniques. My colleague, this one here, the OHT that's left since, she was saying that, I've graduated from uni. I don't see why I can't just, diagnose and treat my own patients. Why does, my boss have to come in and check her charting? And I think, my boss cares dearly for his patients. And if he wants just to calibrate, make sure you and him sees things similar, eye to eye, patients are getting the care that they're paying for because they're really there to see my boss. She wasn't very understanding of that. And so there was a bit of friction there. Be okay in realizing that it takes time to gain your patient's trust and respect for restorative work. You'll be okay to eat a bit of humble pie again. Your patients will go, oh, so you're just a hygienist. my OHT that's left was very sensitive about comments like that, and she was more than okay to make corrections to the speech and use of words of the patients, which I think was a bit abrupt, a bit rude, and it comes across as she wanted that status more than she wanted to care for the patient. Um, how do you handle time management during appointments as a new grad? I think I would tell my boss I'm happy to try out his times. If I struggled with it, was there room to negotiate how much time I require? He said, yeah, totally. So we started on 60 minutes. The other hygienist at the time could do a clean in 30. But I guess we all work to our own standard of care after a sort of happy with the care that you provide and happy to sign your name off. And I told my boss, look, I'm a slow worker to start off with, but this is why I'm slow. He agreed with my rationale and he allowed me to put it up to 80 minutes. How to check contracts for red flags? That I'm not too sure. Maybe Jamie and the team could answer that. I got my brother to check it. My brother's an engineer. He was very um, nitty gritty. But then again, the contract that I was signing was pretty straightforward. It was all there really to look after my boss and look after me. So there wasn't really curly ones in there.
Most contracts are pretty standard, I think we find. So MIPS does have a contract specialist on the staff. So I think they work 3 days a week, 9 till 5. So they're not always available, not 24/7. Don't be calling us at 2 a.m. with a contract question. But certainly we've got people on the team who will look after going through a contract with you, especially if there's something that's standing out to you, then there's a good chance that it's going to stand out to us as well. And yeah, we want to go over that with you. We don't want you to get yourself in trouble with a contract and then have to fork out money for lawyers with you. So let's nip that in the bud and go through the contract with you early. So if there are red flags or anything that's unusual, especially if you compare it to your friends' contract or contracts that you see online and that sort of thing, or contracts that you've had in the past, then yeah, definitely give MIPS a call. We have lawyers,
A 6-year-old patient. So what I
people on the phone ready to help you.
in the instant that you find yourself at a practice that doesn't align with your values, how do you respectfully address this and move on? To be honest, I haven't had to, but I would say it just comes back down to being quite honest about it, making sure that you leave the practice gracefully rather than in a huff and a puff. I think sometimes people ride on their moral high horse and then end up coming across as demeaning, some sort of superiority complex. Like if you just go, okay, this isn't for me. This isn't the support that I thought I'd have. Just go. I was hoping for this and that. And usually, I would say communicate your concerns in between. Don't just sort of have it brewing, 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 and all of a sudden tell your boss, hey, look, this is my resignation letter. Just understanding that the boss is getting used to you, you're getting used to your boss. There's a lot of error of understanding whereby he might think a certain way, but you're decoding it in another way. So I think always, touch base with one another.
Again, I think that's an area you can chat to MIPS about. So we are there for you for that sort of thing as well. So if something is not quite jiving for you in the workplace and you're struggling with a particular colleague or a particular way of practicing, give MIPS a call. Again, we can help you to draft a letter or to use the right words to try and communicate that to the people that are involved. So we want you to be successful in your job. Obviously, that's why we exist, MIPS. So give us a call and let us try and help you to communicate that before you resign. And my advice would be, as someone who has left jobs, unfortunately, because things were just not obviously the way they had been advertised, I think you generally get asked once you've submitted your resignation. Most workplaces will say to you, would you like an exit interview, or can I ask you some questions about why you're leaving, or why on earth are you leaving? And so you will have the opportunity to have that gentle conversation. But as Chai said, you really don't want to burn any bridges. It's surprising who knows who. And when you might need a reference or when you might need to come back to somebody just in a professional sort of conference arena, that sort of thing. So don't go telling anyone that you absolutely hate it and you don't like their style or anything like that. Let's try and be diplomatic and gentle. And again, MIPS can help you with the right wording to use for that sort of thing. Um, but yeah, it's important to be honest, and obviously you want to have your say, and hopefully give the other party an opportunity to improve and make changes so that they don't have to face this situation again. So difficult situation to navigate, but I would recommend waiting to be asked what your opinion is.
And I recommend calling out to MIPS.
Yeah, we are there for you.
I just realized it's 9 o'clock already. So should I start rounding up?
Yeah, I think
Yeah, how
did we
many
have
more
one last
slides?
question come through? And then how long did it take you to feel comfortable practicing dentistry independently? We'll just answer that one and then we'll get off.
all
Or have
good.
you got, yeah?
So an answer to that, how comfortable, how long it took to feel comfortable, I think it depends on what procedure. So I'm about 1 year, 1.5 year in, because I was handed the protocol. So I knew to a certain degree that the expected result that I could have if I followed the protocol, all I had to do was follow it. So by learning the protocol, it took me about 6 months to get a good idea. Um, about 1 year to feel, oh, yep, that's what it's all about. And about a year and 2 months, just a fresh year when I came back from Christmas, I was like, oh, yep, I've got this. Still, though, I think independently most times. And then I know that I could always tap on my boss's shoulder and go, hey, come have a look at this. My indirect stuff, I still don't feel competent in. My endo, I feel reasonably confident with nowadays. So probably I would say a year, but a year with really intense mentorship where he would hold my hand, he would show me what to do. Like he was there, he was committed to me and only me. He wasn't committing just because he had to. He was there to really make me a good clinician and pass on everything he's got. So 1 year.
Cool.
Okay,
Thank you
so
so
I was
much.
going to cover this, but the gist of it is the point of your notes is medico-legal, so make sure your notes are up to scratch. If you don't have enough time to do your notes, make sure you're jotting down the things that are important. Some ways to gain experience, CPDs, daily debriefs, that's really important. Showing that you're humble to your boss is by displaying that you want to debrief or want to hear what feedback he's got for you. Observing him if you've got a bit of a spot in your book. Being comfortable in asking for constructive feedback, massive. If you're able to display that, that tells me a lot about the character that you are. Won't talk about that. Honesty and transparency. I think you can't go wrong with that. If they can't appreciate you for honesty and transparency, well, probably not in the right place. But then again, Lauren said wording. So talk to MIPS about that. Uh, Salary and commission, people ask about that. My question back to you is, does it really matter? If you're coming across as someone who's like, really want to get the money right, like, what are you coming across as? Are you really trying to become a better dentist in your first year out, or are you more about money, money, money? So that's another thing. If your boss is saying, hit these KPIs, that's ringing a red flag. So what red flag does it ring when you ask them and try to negotiate a better salary package? Again, talk to MIPS. MIPS are really good at that. What percentage commission should we be looking at? I'm on 35, but then again, does that matter? In the larger scheme of things, if you get your basic skill set right, which, you know, your restoratives, your endo, your initiation of root canals, get them right, get the right results, talk money, you know, 5 years later, 3 years later. I could probably think now 2 years later, but I'm not really in it for that. Anyhow, these are the tips that my friend sort of gave me. She was saying that she wished she asked those silly questions. She was petrified of hitting the pulp. But once you get started doing endo, you get a fair idea where pulp is. Everyone learns at their own pace. Be kind to one another. Support your colleagues. Remember to have a life beyond your work. So I do a bit of volunteering, a bit of rural health, canyonings, Mother Nature. And that's Jamie when she was younger. So don't burn bridges. You don't know who ends up being in your life for 20 years solid. So there you go. That ends mine. Presentation for the night. Thank you for everyone's patience.